With cases on the rise here and around the world, countries are racing to kickstart their vaccination programs. But we're also seeing reports of some patients suffering allergic reactions to vaccines. To answer some of your questions, we've invited public health advocate Dr. Mikey Vergara. Dr. Vergara, thank you so much for joining us on the program. Let's take a look at a lot of people right now are quite worried that there are cases of allergic reactions with the COVID-19 vaccine.
Okay, yes, there are allergic reactions, none that are really serious enough to stop the vaccination program. Okay? You have the normal vaccination side effects like soreness, redness, maybe a slight fever, some pain, but that's normal in almost all vaccines.
Okay, so we shouldn't be worried about these allergic reactions.
No, but we shouldn't be reckless as well. No, we should be a little cautious, no, and learn from what is happening in Great Britain. No, learn what's happening in the U.S. No, study it and prevent it. No, when it's our turn to have our vaccines.
You mentioned about the word cautiousness, Dr. Vergara. So is it wise that if you have an allergic reaction to other kinds of vaccines, then we shouldn't be immunized with this COVID-19 vaccine?
Yeah, well, it really depends on how serious your allergies are, either to food or medicine or other vaccines. Okay, it's important that when you do decide to get it, that the institution that is giving you the vaccine is ready to treat you for any side effect. Okay?
But are there always allergic reactions, Dr. Vergara, for all types of vaccines? For example, you have the flu, hepatitis, polio, rabies, and others?
Yeah. Well, you see, we're more familiar with the old vaccines, okay? The vaccines that we've been using for many years. We're familiar with that, and we're more prepared for that. We're not quite sure exactly, what the reactions will be for the new coronavirus vaccines. So far, short term looks good. Okay, medium term, long term, nobody can tell us. Okay, which is why we have to observe and, as I said, be cautious.
Does it matter which vaccine we will be immunized with, Dr. Vergara? Because there are several brands being talked about.
Yes, it does matter. It does matter because there are other vaccines that use the conventional way, of making vaccines. We're more comfortable. We've used that type of vaccines before, but the mRNA vaccine, although it's supposed to be very effective, we're not sure if it is very safe. Okay, we're not sure. We cannot say it's not. We cannot say that it is, because nobody yet has gone through a long course of this vaccine.
So does it also help, doctor, that we are only receiving these vaccines by the first half of 2021? So at least we can already learn from the other countries that have already rolled out their vaccines.
Correct. That's the silver lining in the delay of our vaccine supply. We are able to study the other countries and the response to the various vaccines, and it'll give us time to adjust if there is any adjustment needed.
All right. There seems to be a lot of fear right now that we're going to be seeing a rise in the infection rate, particularly here in Metro Manila, to about 4,000 per day and by the end of January. What should Metro Manilans and other of our kababayans basically do at this point to avoid this rising infection rates during the holiday season?
Rico, the people in Metro Manila are getting comfortable with the situation. Okay, I hope they do not drop their guard. Okay, they're getting comfortable. You go out, there's traffic in the streets. You go to the malls, it's filling up. My suggestion is continue wearing your masks. Okay, even if you've had your vaccination, continue wearing your masks, continue wearing your face shield, distance. Don't stay indoors for a long time. Don't be with people for a long time. No? Keep your guard up. Keep your guard up. Okay, and just because you know the person you're talking to, friend or family, that doesn't
Yes.
mean that you can take out your mask. Okay, because you don't know whether you will be infecting him or her,
Right.
or she or him will be infecting you. No? Keep your guards up. Okay.
Thank you so
I like
much.
it when I see people go out, no, because
Yeah.
the economy, you can see it's starting to buzz.
Yeah.
No, yeah, and that's a good part there. No, it's a balance that causes balance.
Thank you so much for this medical advice, and Merry Christmas to you and your family. Dr. Mikey Vergara, a public health advocate.